live for Practitioner Tuesday training. Today we're talking about behaviors that you don't see as overwhelm, but I can see them and I want you to see them. Why? Because we take ourselves out of the game too quickly when we're overwhelmed and we don't even realize we're doing it. One of the favorite pieces of working through clinical reasoning that I experience working with practitioners is this piece right here, not the overwhelm piece, but being able to just clearly, quickly show you the one thing that's in the gap, that if you just got rid of that one thing, you are off to the races. Most of the time, what practitioners fail to see is that they're very, very, very close to exactly what they want. And they tend to think, oh, I missed the one thing, so therefore I must need 10 more things. No, that's not true. We've talked about this a few times already that watching, I'm looking at the live chat here, guys. For those of you on YouTube, hello, hi. So I said watching because it looked like watching. Back to my thought. When practitioners miss the mark on what they want to create, which is a solution, the practitioners who want to create the solution. Not everybody does. Some people just want to create an experience. There's nothing wrong with that, but that's not usually who's here workshopping with me every week. Those of us who are here who want to resolve the pain point. We want to create the change. We want to have this person looking different, feeling different, moving different, and not coming back to us for the third time with the same chief complaint. Those are the practitioners I'm talking to. Most practitioners who fall into that category are very well skilled. They just are. Those of you who are here with me in the club seats, y'all came very well vetted. You've been at it for a while. It's rarely a lack of technique and more often a behavior at this stage of the game. At the very beginning, we probably didn't have enough skill or technique or practice, and then we also were overwhelmed because of all of that. But I'm talking to those of us who've been here for a minute, who've been here for a minute. I just had the privilege of working one-on-one yesterday with a practitioner who I've never worked with before, who's been like us in the field for a while, a couple decades, working on a really complex case. And right when we got to the place where we could break through for that practitioner on that case, I noticed the practitioner do the same thing I'm here to talk to you guys about today. And that is just pull back right when you're right at the finish line, right when you're there to make the breakthrough, we pull back. Putting that pullback under the category of overwhelm. It's a nice way of saying you're quitting. But we don't sometimes even realize that we're doing that. And that is really what I want to talk to. I'm not here to point fingers. I'm not calling you guys all quitters. I started by saying you're vetted. You're here for a purpose. And we get in our way and we don't even see it. In my community, I know Eileen and Debbie and Melissa, you guys come to leadership on Mondays. We talk about this idea about feedback. We bring it up again in level 2 about feedback. I ask for feedback from my clinicians who are in level 3. Give me the feedback. I want to see the ponytail on the back of my head the way you see it, because I don't see it. Not because I think there's something wrong, not because there's something wrong with you. Not because I think I'm not good enough, not because there's nothing good enough with you. Because if you're not willing to see what's in your blind spot, you will be blind in that spot forever. And some of you are doing that right now, and you're in your own way about it. And just, I'm here to invite us all to stop doing that. Even surgeons who we would all agree have more education than we do, even when we've been here for decades, even when we've taken all of our CEs every year, we would all agree that surgeons have more training than us. Would you agree? Surgeons have been at school a little bit longer. Yeah. They also have high stakes, right? You put someone under the knife, just the anesthesia alone could be a problem. And then certainly whatever you do to someone's body. Talk about changing their body by your hand alone. They're not even involved if it's under surgery. Something about that being higher stakes means they take it more seriously. And my invitation to all of us here is to take what you're doing more seriously. Here's what I mean by that. Even surgeons who have that much more training on a complex case, They confer with other clinicians. They confer with other doctors. They confer with other therapists. They confer to figure out the best treatment plan, the probable outcomes of that treatment plan, implications, we call it in my community, and then what they're going to do after the surgery is over. Not all of them get deep into that. I've been in lots of communities where it's surgeons and therapists and trainers who are all in the same room together saying, well, look, I'm going to show you what it looks like under the knife. This is the capsule that I'm working on in the shoulder. And the therapists are like, oh my God, I can't believe you know what to do in there. That's crazy. And then they stitch him back up again. They ship him over to therapy. And the therapist says, look, I really wish that post-surgery you would do this for the order instead of that for the order, because this is the difference between 6 weeks after surgery versus 6 months after surgery. It's a gigantic rehab difference. And the surgeons are like, oh, good to know. I'll send them sooner. Thank you very much for telling me that. I've actually been in communities that train like that. It's wonderful. It's also rare. And in the community of just surgeons alone, they often confer with other providers in their own network. But we don't. We don't. The number of practitioners who are this close to solving a client case study who don't actually reach out for support on that is an astronomical number. Why would you not want to have the answer? Why would you not want to strive? There's something in our community that I don't know exactly what that is. I don't know if it's ego. I don't know if it's like what's that called when you imposter syndrome? Like, I don't know what it is, but a winner's mindset will always want to win, no matter what it costs, no matter the price involved in winning. They'll take more training, they'll call more people, they'll ask more questions, they'll be willing to look messy because their goal is to just win, not to look good in the process. The looking good is just secondary, but the winning mindset is I'm going to strive until I find the answer here. So we get to adopt the winning mindset so that we can then get out of our own way and actually create the results that we said we wanted. We want our clients out of pain. We don't want them coming back. We don't with the same pain over and over. We want them coming back. We don't want them coming back with the same pain that we didn't resolve the first 2, 3, 4, 5, 6 times. We don't really like working Groundhog's Day. Not one of you have ever told me in the 20 years I've been training practitioners that Groundhog's Day appealed to them as a way of working. Even practitioners who do the same circuit training or the same spa massage, they get bored because it's Groundhog's Day. Why? Because we're evolutionary beings. We want to be evolving. And when we hold ourselves back from that evolution, it's what I'm calling overwhelm. There's a lot of reasons why we do it, the overwhelm part. So there's 5 common traps that I'm going to outline for you guys today that generate overwhelm. And if you can keep yourself out of the quicksand, you might not generate the overwhelm. And then if you can spot the overwhelm by way of behavior types, you'll recognize if you're behaving like someone who's overwhelmed and you'll just choose differently. When you're not overwhelmed, you're clear. You got an open runway to win the game. And if that's what you say you really want, you'll create that until you give yourself an excuse and stop yourself from doing that. Okay, is this resonating with anybody here? Resonating? Yeah. Okay, good. I'm glad I picked a topic that seemed a little universal. All right, let's identify the 5 common traps, yeah? First common trap that generates overwhelm is we actually don't know. We don't know. We don't know what to do. We don't know the anatomy. We don't know what we don't know. We don't know joint actions. We don't know what that pathology means. Like, we just don't know. And that is the easiest gap to fill because all of that information is available. I spent years and years and years, dozens of courses filling in the I don't know part for sure. And it's not a personal flaw to not know something. I like to use this math. You guys have heard me say this before. If you've chosen the body as your muse in this lifetime, if you're committed for a career path in service to the body, you're never going to know it all. I remind myself that too. I know a ton. I'm always open to learning more. I know a ton. I'm always open to learning more. Here's the difference. Being open means I'm open, just open to learning. Instead of, oh, I don't know. Wait, does that guy know more than me? Is he going to be able to tell I don't? Is it what he's saying? Is he like that defensiveness, that like opponent posture when someone who has different information from you is in front of you? That not knowing posture is the problem, not the not knowing. The not knowing is given. You're not going to know it all. You go and you get more training. You take a really great course that inspires and lights you up. You immediately apply what you learned. You're good to go. You meet with a mentor or a coach or a colleague who's doing different level work than you are. You confer like the surgeons do. And the practitioner says, hey, do you know how to do orthopedic assessments? And you're like, do what? Wow. Open. What's that look like? What would that do for me? Where do I go learn that? Do you know joint actions? Do you know your muscles? Do you know the way they move? Well, I took the state board exam. Does that count? No. Okay, well then great. I'm going to go back and take a muscle score. Yeah, but they're really boring. Find an exciting one, right? Easy solve. But the posturing around not knowing is a behavior that's going to take you out, right? You'll be defensive, combative, dismissive, and you'll quit before you get the answer from the person you're conferring with because you don't want to look like you don't know as much as they do. That behavior doesn't work, guys. It's not even how surgeons operate. Pun intended. Oh, I did. I'm here all day. Tip jars on the left. Okay. Another common trap. It's rare when I pop a joke, guys, because I'm super serious when it comes to this work. So it's like we got to take the wins when we get them. Okay. Another common trap that generates overwhelm is we treat symptoms and not the source. You guys have heard me say this over and 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 over again. Remember the math. 90% of the pain that presents is referred. As soon as someone says, oh, but their shoulder is tight and their pecs are hypertonic and their hamstrings aren't releasing, and symptoms, symptoms. You start chasing all the symptoms, you'll be chasing for a while. You'll be overwhelmed with all the chasing you get to do and all the lack of results that you've actually generated. You'll be overwhelmed. And then if you've got that posturing thing going on, you'll say, well, this is how it is for that client. No, you quit on them. That's what that is. You quit on them because you chased symptoms, got overwhelmed, spooked yourself, and then got defensive about it. That's a rookie move. Do not do that. Don't do that. Okay, another common trap that generates overwhelm is we act too soon. We act too soon. Some of that's by design, which I'll talk about here in a second, and some of that is the overwhelm leading, actually. You don't know what to do, so you jump in to do. You want to be helpful, so you jump in to help. You don't want them to be in pain, so you jump in to do something about it. You tried it 3 other times and it kind of worked on 1.5 other people, so you jump in to try it again just so you could get like the pain to stop. You jump in too soon instead of using your clinical reasoning to sort out what's actually needed here. What's everything I am perceiving and assessing, and what's the meaning around all of it? That is a skill that gets to be developed that is not developed in technique courses. Nothing against technique courses. I'll say it till I'm blue in the face. There's nothing against technique training, but the technique training does not teach you clinical reasoning. Clinical reasoning teaches you clinical reasoning. And if you can't reason through the techniques, you can be loaded with them and still not generate results. And that also generates overwhelm. It actually erodes your confidence and you're like, oh my God, I've done all this training and I still don't know what I'm doing. By design, we often act too soon because that's our formative training leaking into our advanced approaches. For massage therapists, it looks like this. We're taught you have a 30-minute, 60-minute, 90-minute session. That means the patient, client's on the table and I'm doing the work for them. Massage is passive by design. Active on the clinician's part, passive on the client's part, which means you mistakenly think you have to be in action with your hands the whole time that you're working to be paid for the time that you've been working instead of paid for the results that you create. which is an advanced approach. It's not a formative approach. Formative approach is time is ticking. Minutes are counting by. In movement, it looks the same. If I'm teaching someone to move, if I'm giving them a workout, whether it's in a group class or in a one-on-one session, they're here to work out. I better get them to a certain cardio and weight level so that they can start sweating, so that they can start getting gains, so that they think I'm a good enough trainer, Pilates instructor, yoga teacher to get them the workout that they came here for. And yoga teachers will be like, oh, I don't do workouts. I do an experience. Okay, except that they can't do half the moves you ask them to do because they're physically uncomfortable. Which leads you back to if you want to resolve the musculoskeletal pain, you gotta choose a different approach and not act too soon because you will become overwhelmed about why your client student can't do the movement that you're asking them to do. And then you'll wonder if it's you or them. And then you go into the posturing thing again. The posturing doesn't work. It's the opposite of partnering. Oh, that just clicked. Partnering versus posturing. See, I'm this many years old and I figured that out. It's good. It's good. Okay. Another common trap is not understanding implications, and that's definitely an advanced path, understanding implications. I alluded to it already when I spoke about the techniques. If you learn the technique, but you're not clear what the technique is designed to do under what circumstances and what the outcome needs to look like based on function, structure, and biomechanics, then you're just rote memorizing a technique by steps. That's knowing a technique by steps. It's not understanding implications to be able to utilize clinical reasoning, which is why when they work, you get excited, and when they don't work, you have no idea why. But when they work, you don't know why either. That's the hook. Implications means you're in a knowing space. You're in a knowing space. And if you're in a knowing space, then you know. And now you're the owner of that session. Are you typing me a love letter, Eileen? Oh, okay, I thought you were typing. All right. Number 5, the fifth common trap that generates overwhelm that I've seen is trying to generate a result instead of being in ease about the results that are inevitable. When you don't act too soon, know the implications, have strong clinical reasoning, and then approach it in that way. There's a lot of trying going on. There's a lot of efforting. There's a lot of confusion and more approaches, more techniques. Try, 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 try. And you guys, we're already working physically hard, right? Like using our bodies to serve someone else's body is already a physical path. I mean, we're not bricklayers, but I've been exhausted at the end of a client day too, right? Still, like you never get better at that. It's physically expenditures, not taxing. I don't want to, it's not a negative thing. It's a reality thing. It's a reality thing. I mean, we used to say that working hours for dollars was a limit because you can only work during daylight hours and still be professional. Thank God we only work during daylight hours. Can you imagine a 24/7 output? We wouldn't make it. So that by design, we have to work that way because it's physically expecting us to output. It's already a physical output, which means that when it comes to clinical reasoning and putting an effective treatment plan together, that shouldn't be harder on top of what's already physically demanding. All that trying and not knowing and trying harder and then not knowing and then doing another weekend workshop and quick like throwing that on top of it, all of that trying and not knowing is hard. It's hard for you. It's hard for them. It's hard on your career track. You're going to burn out. Even if it's just low grade lack of confidence year after year after year, that's a slow burnout. That's not a, end while you're on top kind of feeling. We get to end when we're on top. The longer you're here in this industry, the more of an expert you get to feel. Expert status has huge responsibility that goes with it and a lot more ease because you know some shit. You've had a track record. You've measured your results. You know what your benchmarks are. It's easier. That part's easier. The responsibility, harder. The complexity that comes in, more challenging. But you don't get more taxed the longer you work. I'm on the threads in socials a lot, reading, especially massage therapists. And they're like, you guys, I'm 5 years in. I cry at night and I ice my hands, and my feet are killing me. What shoes do I wear? How can I do the same techniques if I have to raise my table? Because bending over is just breaking my back. And now I've been diagnosed with XYZ, insert musculoskeletal diagnosis here. And they're not going to get treated for that in the Western world because that's not who does it. We're the ones who are supposed to do that at this level of clinical work. So then those practitioners end up leaving the industry, physically spent, like run over at the finish line spent. It breaks my heart. It's not supposed to be like that, guys. It's meant to be easier as you move through, less physically demanding on you and on the people you work with. Okay, and when you're not making it easier, hi Manuel Lewis Delgado, love and light to you too. When you're not making it easier for you, you get overwhelmed. And when you get overwhelmed, you want to quit, understandably. If your body doesn't tell you you have to give up sooner. We don't want that. We don't want that. We want to make it easier. So if it's not easier for you, what's in the gap? Right? What can you do with that? Who can you confer with to get you there quicker so that you don't burn yourself out? So that you can see the answers showing up more readily, so that you can just like wipe away all the distraction and just see a clear line through to the finish line, to the solution. Where can you go for that? Who do you want to align with? Pick a colleague, pick a mentor, pick a program, something that holds you to it. There's also a behavior around we're just exhausted from all the training we've done. And I'm exhausted right now looking online, different conversation, but only 38%, 51% of what we saw online at the beginning of this year was human. A month later, beginning of February, 38% of what you see online is human. 38. That means ads, videos, people, conversations, copy, written text, instructions, videos, how-tos, not even human. So, cool. Like that's innovative and awesome. And I'm definitely innovative by design as well. But if you can't ask someone a question, how are you going to get there quicker? And we're all a little taxed from all the training we've done, so we don't want to ask anybody a question. Like, what are you selling? That posture again, that defensiveness, instead of, hey, do you have the answer for me? Are you someone I can confer with? Right? The opportunities for us to actually lean in and have a real human who cares and is clear and has a track record, those opportunities are going to diminish. You got to find your community where you can lean in with real humans doing real work at a high level and be willing to be open to that instead of on defense about it. And then you're gonna end up not knowing who's real or fake in a very like 6 months, I'm guessing. I don't know. I don't do timeline guesses, but it's fast. It's coming fast. Okay, I got a bonus one for you. I've got a sixth one actually. A sixth common trap. And that is, I used to think it was a beginner trap, a beginner minded trap. But after my most recent conversations, I'm going to tell you that it happens at all levels. It's a little bit like the posturing we talked about, and that is performing. Performing to look good and camouflaging what you're not yet able to resolve. You want to look good, you want to perform, you want them to know that you're good, you want to say all the right things and do all the right things, but you don't actually want to have a backstage view. You don't want to be caught in the dressing room getting ready. You don't want to have a broken heel on the bottom of your shoe and then dance through it anyway. Like you don't, for any of you who's performers, that resonates with you. You don't want to not look good. So even when you are thinking that you're open to conferring, With a colleague, you're going to posture because you want to look good like you know what you already know instead of being open to what you don't know. And you spend more energy posturing so that you aren't perceived as not knowing instead of just positioning yourself to have everything that you can retain from the expert that's sharing with you. Like, what is wrong with that? Early on, very early on in my career, I was thinking about this. I'm like, who did I lean into? Oh my gosh. The president of my school, president of my massage therapy school, I'm telling you, I was in his office at least once a week. As I look back on it, I wonder if people thought something else might have been, the draw for me there. I literally was just asking him, okay, Debbie, see you in lab. I literally was just asking him question after question after question after why? Because he was a massage therapist, a professional dancer, and a mechanotherapist, which doesn't exist anymore. It's a version of when massage therapy meets chiropractic. He had a view of the structure of the body that no one else, okay, Eileen, see you in lab, that no one else could explain to me. And he embodied it because he was a dancer. I asked that man countless questions every week. I just leaned in and wanted everything that he could tell me. But if I had walked in thinking like, oh, well, I didn't get an A on my last test, or I don't want him to think I don't know what I'm talking, then I would have never been able to be open to that information. I wouldn't have gotten all that structural help because I would have been posturing. When we posture to look good, we're spending all of our energy instead of utilizing the resource that's in front of us. Same thing goes for the physical therapist who referred that patient to me that was in neuro. I've told you guys this story several times. I asked her what she had done, what her treatment plan was. Not because I was in competition with her, because I really wanted to confer with her on what was going on. And then what else could I do that maybe she didn't do? And that's how I got started. But if I hadn't been open to asking those questions, if she hadn't been open to referring to me, neither one of us would have ended up where we are today. And most importantly, that patient that we both served would not have been pain-free. She might have ended up with surgery or paralyzed. Who knows? It was in her neck. So notice how many times you want to look good instead of lean in. Notice how many times you're camouflaging the places that you still get to expand yourself and that you're creating your own overwhelm. You're creating it because you're spending all of your energy on the wrong focal point, on you looking good instead of knowing more. You'll look good when you know more. You'll also look good when you're courageous enough to ask. And when you're authentic enough to say, I gotta do more research on this. There's a gap here for me. I'll be right back with you, client. I'm gonna go confer, right? Okay, so behaviors that we don't see as overwhelm start with these traps, and then they start looking like overwhelm. You're over talking, you're talking, you're talking, you're talking, you're talking. Not like me right now. I'm in a teaching moment. I'm talking about, this, when you're with a client and you're just talking and you're not even like keeping track of your own conversation, you're over talking. One of us here last week said, yeah, I overtalk a lot. Okay, that's overwhelm. When you're clear, you're calm. When you're clear and calm, you don't overtalk. That's how you know you're overwhelmed because you're over talking. If you find yourself over talking, over explaining, just notice I'm over talking right now. I must be overwhelmed and not even recognizing it as overwhelm. Okay, good. I'm going to do something different then. Zip it. Overwhelm behavior also looks like freezing. Oh, I don't know. And then you try to recreate the scene, right? If you're a freezer, not a freezer like a refrigerator freezer, but if you are a person who freezes, you're overwhelmed. Cut through the overwhelm by either conferring with a mentor that can support you on that, working with your leadership, or training on more knowledge so that the more you know, the more you can sift through. Another behavior that we don't recognize as overwhelm is we take ourselves out of the solution. This happens so often when I'm with training, and the practitioners that experience this aren't even aware that they're doing it until I call them on it with love, of course, because I want them to see the ponytail on the back of their head, just like I also want to see the places that I get to grow. And the practitioners who train with me know that when I call them forward, they're like, I'm about to get a hit of awareness here. Mhm. Absolutely. Once you're aware, you're in command then because you're aware you have your own autonomy. You're not aware, you're walking around blind. When practitioners come through a case study with me, okay, I tried this, I tried that, I tried this, I tried that. You'll catch this in yourself if right after you share all that and there's more to discover, like in an audit, if you're in an audit with me or if you're in a training with me and we're working through a case study, right at that place, there's more to discover. Guys, that should not freak you out. Of course, there's more to discover. That's why you brought it up because you wanted clarity on something you didn't have clarity on. So, when we want clarity on something we don't have clarity on, and then right as we're about to get into the mix of finding out what's missing, we pull back instead, or we deflect and change the subject, or start defending what we did, you took yourself out of the solution because you're overwhelmed by the process of transformation that's required for you to see something differently than what you've seen already. The irony here is that by bringing a question into a learning environment, you're already setting yourself up to want to know the answer, and then you take yourself out of getting the answer, and then you've confused yourself. The overwhelm isn't how to get clarity on the answer. The overwhelm is that you just went double-minded on yourself. I'm here to learn, I'm here to get the answer, and as soon as I'm getting close to getting the answer, I'm going to bait and switch on myself. Don't do that. You won't get what you actually want, which is the solution that you deserve to have, that your clients deserve to receive from you as well. Okay, my friends, is this landing for you guys? Is this kind of training and mindscaping valuable for you? If you guys are here in the live chat, give me a thumbs up if this is resonating as like, yep, this could be a few places that I get to look at. If you're like, no, this stinks, Gina, give me a thumbs down. I'm open to the feedback. Let me know if this type of clinical reasoning prep feels valuable to you. Thumbs up or thumbs down. What about you, Melissa? Thumbs up or thumbs down? Thumbs up. Okay, thumbs up. All right, excellent. I find it valuable to be in connected conversations on these topics so that we can create the results that we want to create without having to stress ourselves about how we're going to generate them. When I meet really qualified practitioners who are still in angst about the work that they're doing or the results that they're generating, it pains me to great measure. So, my personal mission in my professional life is to change that, to raise the standard of care that we're all here to deliver. And the way we raise the standard is by raising ourselves to that standard. So I'm going to thank you all for being here with me in this conversation today and the many more that we will have till we all get to rise to the level that is our deserved space. And until I see you guys next time, continue to do great work in the world. I'm going to wrap us up here just a few minutes early because I do have my Shots Method practitioners prepping for a lab. That's why a few of us dropped off here. We're working with clients today, giving them techniques that they get to do with their clients, and I'm observing. And so there's a full house. Lab days are usually fun because we have guests in the house, clients who come in and are like, what are you working on today? So I'm going to wrap us up here for our Practitioner Tuesday training just a few minutes early so I can switch my Zoom line and get our clinical space ready for the clinic lab that we have going on. And I look forward to seeing the rest of you next week for more Tuesday training. Until then, be well. Bye.